So we are live on Facebook and Zoom as well. So, ma'am, Dr. Saab, I need your permission to start the webinar.
Yeah, go ahead.
Yeah. So, good evening, everyone. Who all are attending this webinar on coping infertility emotions during infertility. So, on behalf of Indian Fertility Society and Cooper Surgical India, I welcome you all. So, we are really honored to have the esteemed panel from Indian Fertility Society and especially interest group Holistic Medicine. So as we all know, infertility is a long journey full of emotional ups and downs. So imagine a couple going through the infertility journey. They have really high hopes and they have to face so much emotional, I'll say breakdowns. They have to go through so many things, the hormonal imbalances there with the female part, and then they have this high hopes. Then the treatment is being done and they're waiting for the results. And somehow, as we all know, the success rate in infertility treatment is not that much higher. So it's really difficult for a couple who is going through infertility treatment. When they hear about the negative results and when they hear about the negative outcome, it really shatters them inside out. So we were celebrating Infertility Awareness Week, and we thought to have this webinar with the help of Indian Fertility Society and SIG Holistic Medicine. So now I would introduce our esteemed panelists. So I'm sharing my screen. So with us today, we have Dr. K.D. Nayar, President, Indian Fertility Society. He's Chief Consultant and HOD at Akansha IVF Center at Mata Chandradevi Hospital, New Delhi. So Dr. K.D. has actively dedicated his career to the cause of infertility management for the past almost 30 years, and several leading IVF specialists throughout India have been trained under him in infertility management, and he commands a lot of respect in the medical community, and we are really honored to have you here, sir. He's also the course director for FOXY and Basic Advanced Infertility Training and IUIs. Along with Dr. KD, we have Secretary General in Infertility Society, Dr. Surveen Bhuman. She is Senior Consultant, IVF and Reproductive Medicine at Max Super Specialty Hospital. She has received numerous awards and accolades for contribution in the infertility landscape and have been an undergraduate and postgraduate teacher for the last 22 years. She has written 8 books, 6 on infertility, and 3 have been published internationally and have over 70 publications in books and journals. So I welcome Dr. KD and Dr. Surveen on behalf of Cooper Surgical India, and we are really honored to have you here, Dr. KD and Dr. Surveen. So over to you, Dr. KD, for the words of motivation.
Good evening, ladies and gentlemen. Today I stand here proud as President of Indian Fertility Society, and I bring you greetings from the whole IFS family spread across 29 chapters in India. At the outset, I would like to acknowledge the efforts of the present special interest group, Holistic Medicine, under the able leadership of Dr. Rajvi Mehta as the convener, and Dr. Ritu Jain and Dr. Shalini Chawla Khanna as the co-convener. I'm sure this SIG is going to establish a new benchmark in various academic activities. The next 2 years, hopefully, will mark the re-emergence of life as it was before Corona. And we are optimistic that we will be able to deliver a term of interactive academic meetings. My vision for next 2 years is a quality academics and research in AIT. And the aim is to have one research project which can be published in our journal from each SIG. And I would like that IFS will bridge the gap between knowledge and action. That is important, to bridge the gap between knowledge and action in the field of infertility. And we must together work together to make IFS a yardstick of quality. Thank you very much.
And Dr. Surveen, some words for today's session.
Thank you so much. I thank Rajvi, Dr. Poonam, and the co-conveners for holding this and having us over for the introduction. I think this is a very important topic which is coming up. Infertility can affect all aspects of people's lives, their psychology, they have emotional disorders, they have depression, anxiety, hopelessness, guilt, feeling. We all know that. And to the tune of 25 to 60% of infertile couples are suffering from this, either because of the treatment method or the cultural beliefs they are subjected to, or it's been a very prolonged infertility. Studies have found that infertile women are more neurotic, more depressed, more anxious. So this this particular session is definitely the need of the hour. The solution lies not just in fighting this anxiety and depression or stress, but consciously modulating the habits that intensify the stress and grow these habits, or by growing habits which decrease the stress. That is yoga, meditation, which I think Rajvi is going to talk about. And I myself am a strong believer of yoga. Yoga is not about, just touching your toes. It's about what you learn on the way down. It's not something to be performed. It's something to be lived. Yoga is something you put in your life as a way of life. And sometimes the most important things in the whole day is that period between two breaths you take. You're inhaling your future, exhaling your past, and it's the power of now, which really helps you to move on through your depressions. So I don't think we need to waste any more time. And let's hear what Dr. Poonam and Rajvi have to tell us on this topic. Thank you.
Can I start?
Yeah, thank you. So now I'll introduce our first speaker, Dr. Poonam Nayar.
Mhm.
So Dr. Poonam Nayar is the consultant clinical psychologist at Akansha IVF Center. She has been into teaching and research for 15 years in integration of mind-body methods with existing standardized treatments for stress management in psychiatric disorder and IVF treatment. She has conducted numerous workshops, presented papers in national and international conferences, around more than 25 publications in various national and international journals. She is chairperson for pre-Congress workshop on counseling and psychological support at National Conference of IFS. And she is also the co-convener for SIG Holistic Medicine and Infertility Society. So today, Dr. Poonam Nayar will talk about emotions of infertile couple. Over to you, Dr. Poonam. So you can share your screen, ma'am.
Okay. Now, I have to take one back
Yes, ma'am.
from the beginning.
Yes, ma'am. Just click it anywhere and press the back button.
It's not moving.
Not yet, ma'am.
No, it's not moving.
You can stop share and reshare again. No problem.
Okay. Let me close it and.
Yes, ma'am. You can open it again and
Okay, I'll do that.
from the first slide itself.
Okay.
So for the audience, it is a request in case you have any questions, you can write in the chat or in the Q&A.
Okay.
And even during the session also and post session also, the questions will be answered by our esteemed panelists.
Okay, so I will
Yes,
be.
it is visible. Yes.
Thank you, first of all, for giving me this chance to share my knowledge about this area. And every time I prepare a presentation, it's actually a relearning experience for me, which I really love. So we'll talk about emotions of an infertile couple. And, how can we understand them and how can we relate with their subjectivity? Why isn't it moving?
You can click on the screen anywhere and then press the down button.
Okay.
Yes, ma'am. It is moving now, ma'am. Perfectly moving.
So this is basically infertility is a very complex medical situation. And any complex medical situation presents significant challenge to achieving well-being. And infertility and its treatment is considered as a major life stressor, along with chronic divorce, bereavement, HIV, cardiac problems, and so on. So, what is it that makes infertility so complex? One is that there is uncertainty about the causes. The treatment is very long. During this process, during this period, couples have to undertake a number of diagnostic tests as well as attempt a variety of treatments. For example, ovulation induction, IUI, superovulation, cycles of repeated interventions. And by the time couples reach the point of IVF, which is the final end point, they have been infertile for 6 years and have been in treatment for 4 years. So imagine a 6-year journey. It's very, very long. And here, despite this effort, despite this whole scenario, the success rate is 30 to 40% with the best knowledge and the best technology. So because of this long period, many couples experience frustration and disappointment of failure to achieve pregnancy. Now, this is for women who struggle to get pregnant. Fertility treatment was promised to be a medicine of miracles. The price was steep, both financially and emotionally. Hence, the failure became very devastating. Now, exposure to stress of this magnitude has deleterious effects on the overall well-being and the quality of life, even long after the treatment has ended. Now, this is the outcome. This is the data on outcome of unsuccessful treatment. There's a whole section of people who go back, who go out of, exit the treatment with a persistent desire for a child. Now, the studies have shown that when they enter the treatment, they are happy, they are optimistic, they are hopeful. And in fact, at the beginning, the incidence of psychiatric disorders is the same as in general population, which is 3.5. But after this 4 and 6 years long journey, 10 to 20% get clinically significant depressive symptoms. So clinically significant depressive symptoms is a serious thing. And 25%, 10% had depressive disorder, full-blown clinical mental disorder. 14% women and 5% had anxiety disorder. Look at the jump from 3.5 to 25. Imagine that they have not gone back with a baby, but they have definitely gone back with a lot of other problems. So this is that pregnancy dream, or is it a nightmare? This is the outcome when you do not address this desire for a child, which is purely emotional and psychological. It does not threaten their physical well-being, but yet its impact is so profound. Now, challenges of, people try to cope with infertility, and they have like emotion-focused strategies. They try to create pleasant emotions. Then they have problem-focused strategies. That is, they try to analyze the problem to find different solutions and so on. However, despite all this, coping with infertility stress remains a challenge, and the couple do not know how to tell others what they needed in order to achieve their well-being. In fact, this explains it all. Infertility this is an expression by a patient. It is the worst thing that happened in their life. Now, if we look at the process of treatment, before treatment, during treatment, and after treatment, in this journey, there is a lot of difference in the psychological makeup at the beginning, during, and after treatment. And whatever the stage of treatment, there are certain common processes which are happening. So I will be addressing those. Now, first is the grief reaction. Where is the grief? One grief is when you lose a loved one. Another grief is when you imagine you had a child, you're going to have a child and you never get it. So it is as much of a shock as an actual bereavement. Diagnosis of infertility triggers a grief reaction. During the journey, when they get pregnant and then they lose the baby, there's another grief reaction. In the end, when the outcome is not as per their expectation, so there are these complex of emotions which are happening. And as a clinician, one need to understand that if a patient is undergoing grief reaction, at what stage is he or she likely to be, and handle the situation accordingly. If you look, the first 3 stages is intense emotion, shock, anger, depression. So the overwhelming emotion is there. that is not the time to sit down and talk or to defend the clinic and the doctor technology and so on. But once the emotion has subsided, then they are in a state, they are able to start talking about the situation logically. And then that is the time to introduce counseling. Prior to that, we need some stress management and relaxation. Now, talking about infertility is very difficult. Patients say that we can discuss the physical and medical aspects of the treatment, but describing the emotional aspects is very difficult for them. And why is that? Because infertility itself is a taboo. There is the predominant cultural view is that sexual and reproductive health is a matter of privacy. And how can individuals struggle to talk about it in socially appropriate ways? And individuals report feeling frustration, awkwardness, discomfort, tension, which often results in topic avoidance and a feeling of social isolation, which is a very common reaction of infertile couples. They stop socializing. Now, this is the patient's view. She says, infertility is an invisible condition and it's really hard to explain what we are going through. I am really short of words to say, but it can often feel impossible to articulate the emotion that I'm not sure I can even put into words. So deep and so powerful is the emotion here that they are literally rendered speechless. And finding an outlet for an emotion when going through infertility is so important to get the stuff out of your head in some way, shape, or form. So here, most people, they want to talk about infertility. They want to continue discussions about infertility, but feel that they are making others uncomfortable, or they feel others don't understand the emotional sadness and anxiety that accompanied infertility. And when women were asked, they responded to questions about their infertility status with direct and indirect disclosure, lies, and responses that would point out the other's rudeness, that people are rude and so on, instead of talking about their infertility. So another thing is that even when couples disclose their diagnosis, they feel frustrated by the conversations about infertility. Disclosing infertility may make it more difficult to maintain privacy boundaries on related topics like financial, emotional, or relational difficulties. Given these challenges, it can be difficult for members of social network to provide effective support to someone with infertility. So here is a problem where they want to talk, but they are unable to talk. They are unable to draw boundaries, how much to talk, with whom, and when. So another interesting thing is they use metaphors. What is a metaphor? That when you cannot describe the depth of pain, anxiety, and sadness associated with infertility, then the patients turn to metaphorical language when literal language is insufficient to explain the complexity of their experience. So this is the kind of language they use, and they find it difficult to effectively communicate abstract emotions like feeling unstable, disconnected, insecure, out of control. So they use concrete conceptual metaphors like I'm on an emotional roller coaster. I'm working hard at the job of getting pregnant. I feel like I'm on a war footing. I feel empty inside. I feel this is a dance, like how much to say to whom, when, and where. I feel I belong to an infertility club, and I think I'm ill and I have a disability, and so on. So this is how the metaphors, they are used by the patients to communicate to a person who has never experienced infertility. And they use these metaphors so that we can actually understand them better. Now here, this is an example of a job metaphor. When they said, this is like in a job, you have a goal, you have tasks to achieve, and when you do the tasks efficiently, you reach the goal, isn't it? But here, they obviously, this is a wrong metaphor. And why I'm discussing this is because once the patient is using these metaphors, it gives an idea to us about the narrative which they have created in their mind about their pregnancy, their infertility, and their life in general, their identity with respect to the infertility experience. And that is very important for the therapist to understand and to put in corrective narratives in place. So here the thing is that they say everything was followed, all instructions were followed to the last detail. Because of medical side effects, numerous doctors' visits, financial constraints, physical pain from the treatment, one patient explained that sex was not about intimacy or connecting with a partner. It was about achieving the goal of conception. So this kind of attitude obviously is not going to help in the journey. So this was particularly salient for women interviewed, many of whom felt that it is their job to produce a baby and to deliver it. And here, when this doesn't happen, then such a narrative means they mention failure, feeling of incompetence, frustrated, and they said, why when I'm doing all the right things? And many participants mentioned that their feelings of failure increase, especially when others seem to successfully become pregnant, and when it seemed that the more they failed at conceiving, the harder they tried. So this is a way of mishandling their own emotional state and probably sabotaging their own selves. So after several cycles of infertility treatment, Richa, 33, began to internalize the failure. I remember one night, I just felt like a failure and I wondered why my uterus would just not cooperate. Another metaphor which is used by the patient is a roller coaster. That is, this is a patient entered her first IVF procedure thinking that it's going to work because she's young, the doctor is optimistic. She conceived, experienced momentary elation, but lost the baby a few weeks later. An emotional experience she was totally unprepared to deal with. So after the first IVF, the miscarriage was very difficult. I remember telling my husband, even with all the physical pain of the IVF, I can do that part again, but I'm not willing to go through with this again. So just to finally feel like it was something you have achieved, and then it just slipped away from your hands. So it's like you get on top of the roller coaster and you go all the way down at the bottom. This is awful. This is the big crash, which we are all familiar with and which has to be dealt with in a very systematic way. Now, other people refer to it as a game. It's like a game of die, probability. Why is it happening? What are the stacks against us? What are the odds and chances of success? How can we cut the losses? How can we improve the luck? So this is, where these are the kind of metaphors. Then the metaphor of being stalemate or being stuck. When, they feel trapped, hopeless, and being in a situation when the individual was out of options, losing or giving up. So a couple made the difficult and unhappy decision to stop treatment during their secondary infertility experience. To continue on with the treatment meant sacrificing more money for a possibly fruitless venture, which would be very bad, while stopping meant that they might have ended treatment too soon because it was uncertain if they might have had more children. So it is like stalemate. They don't know which way to go. And here, this happens quite a lot during the infertility treatment, where very difficult decisions have to be made, and there is no clear-cut guidelines. And as a result, the latest focus of research is on developing decision support tools to help patients deliberate their choices in such situations so that they don't feel they are stuck and they are being one hopeless situation to the next hopeless situation, they are being tossed around. Then others say that it's a battle. They say they assume a military identity while protecting themselves and others from emotional pain, fighting for a joint cause, and experiencing the undesirable invasion of their body and personal life space during treatment procedures. Many people mention the experience of healing and surviving. healing and surviving, being wounded and dealing with scars. So this is the metaphors which they use to describe their infertility journey. And they felt that mental health counselor was necessary to facilitate this healing from infertility experience, much like a soldier returning from war. Then others say that they say infertility is a medical condition. It happens through no choice or fault. And patient said, I treat infertility almost like a cancer. It is not something that anyone deserves. So this is all the, the negative cognitions around infertility journey, which need to be looked into seriously during the counseling process. And another woman equated the inability to have children to having a disability, a condition that impacts both her personal and social identity, a disability like being unable to walk or without limbs or something. So she said, every time somebody says, oh, I have a child, I feel resentful because, why can't they see I don't have a child? I don't have a child. And why are they telling it to me? So they want others to give them special consideration, which is again an unrealistic expectation. Then infertility is a dirty secret. Lot of time, male factor infertility becomes very important here. And they feel it should be kept secret from others, either because they thought it was inappropriate or too private to share, or because they felt others were embarrassed and uncomfortable hearing about it. In their interviews, individuals talked about hiding their infertility, only sharing it with close circles, feeling that others believed it should be swept under the rug, and feeling they should not air their dirty laundry. Here, a patient talked about how she and her husband initially shared more information with others, but then after the first marriage, miscarriage and subsequent unwanted advice, she kept all information about infertility treatments and emotions between herself and her husband. So they decided to withhold this. However, she also mentioned that the secret then became too much to bear, and it began changing how they interacted with others. So the effect on the social life in general. So another very interesting method, which is I thought I must share with others, is drawing out. It is a metaphor-centered drawing method which is being used to help the patients express their feelings, and the drawings are used as a tools for discussion and developing insight and awareness. So here it is designed to collect visual and textual data about individuals' experiences of sensitive or taboo health-related health experiences. Now, drawings are actually visual metaphors, and the ability to provide appropriate and equitable healthcare requires that practitioners have insight into the personal meanings which patients attribute to their health condition. And drawings are used to perceive and create meanings of their experiences of health and disease. So it is also important to note that methods based on verbal conversations may hamper the communication of emotion-laden experiences that were not coded verbally when originally stored in memory. So drawings can facilitate the retrieval process of such highly charged emotional memories. And in fact, currently drawing is used as a projective technique. It's useful for patients who either resist revealing or who are not aware of their underlying motive, urges, and intentions. So it's a very powerful tool in psychology, which is now being applied here. Therefore, drawings can be a useful tool to help people express their views about sensitive and taboo topics. So this is a drawing which is given by my infertility experience. Now, she describes it as a monster hippopotamus ape. And the fact that one can't have children is so scary and frightening, like a monster. So this itself creates such a lot of profound information. And I think this also is very useful in the therapeutic work. This is another drawing containing the rift metaphor between the partners. So the drawings actually bypass the conscious ego-based defenses. Now, there is drawing of high pressure to have children from their communities. And this is the result of traditionalist view of family and parenthood. And children are highly valued. Women are perceived almost exclusively as caretakers. The women commented that other members of their community, particularly the older generation, were often confrontational and made insensitive comments. So this is a drawing depicting social pressure where comments, random comments coming from people around in the social network. Why are you cheerful? You are barren. You should be sad. You were cursed. Where are your children? Why have you got only one? Try harder. Marry another woman, and so on. So this is, a journey into the inner world of the patient and how they express themselves. And if we can interact with them at this level, I think we will be better able to handle their problems, help them to de-stress, and have a better narrative of the infertility and their own life identity. Thank you.
Thank you, Dr. Poonam, for the wonderful talk. Ma'am, should we take the questions at the end if the audience have, or what do you suggest, Dr. Rajvi?
We can take it at the end. So
yes, that would be much better. Yes.
Yeah.
So, ma'am, we'll proceed to the next session. So, I'll introduce the next speaker. So, with us, we have Dr. Rajvi Mehta. She's the convener for Special Interest Group Holistic Medicine Indian Fertility Society. She's a highly experienced clinical embryologist and recipient of many accolades in her field. She is also the senior Anger Yoga teacher, editor of Yoga Rahasya, and advisor to the Ministry of Ayush. She leads a special interest group on holistic medicine for the Indian Fertility Society. So in today's session, Dr. Rajvi Mehta will have a live demonstration on how yoga can help in handling emotional stress. Over to you, ma'am.
Thank you, Wakil. And thank you, Dr. K.D. Nayar and Dr. Surveen, for letting us have this nice SIG meeting. And thanks, Dr. Poonam, for starting this out. As Dr. Poonam has actually narrated the entire journey, even as listeners who may not have taken this journey, we realize the extreme emotional pressure that the infertile couples are facing. And I would like to say that, often I feel that infertility is not just a reproductive disorder. It is actually an emotional disorder because the symptoms that the couple faces are emotional. Not having a child, as Dr. Poonam said, is not going to have any physical limitations or physiological limitations, maybe in cases of endometriosis or PCO to some extent. But in any other cases, there is not going to be any kind of effect on the current life, but it's all emotional. And in case of any kind of disorder, the first thing a therapist does or a doctor does is give symptomatic relief. So I often say that if a person has a backache, the cause of the backache could be a slip disc, the cause of the backache could be a tumor, the cause of the backache could be tuberculosis. But whatever it is, the start is to give some symptomatic relief and then proceed to the cause and then treat the cause. However, in case of infertility treatment, or even during the diagnosis, we directly jump to the reproductive system and start working on that with very little attention being given to the emotional aspect of this disorder. And unfortunately, like any other disease where the patient can freely go and talk to people, oh, I have a knee pain, and they will have a group of people which will advise each other on how to handle this. In cases of infertility, it is very difficult, or I would say nearly impossible for a couple to talk even to their closest of friends. To add on, even like they said, if they want to keep it secret, it sort of builds up into that. And irrespective, there are thousands of people in society who may or may not be connected, who would be advising them on why they're not starting a family. And in India, this is very, very common. So the pressure comes not only from the couple themselves, the close family, it also comes from the society. So add, the emotional strain is so very high. To add on, the treatment like IVF just extremely enhances anxiety. I mean, waiting each day. How will the follicles grow? How many follicles have grown? Will there be oocytes? Will they fertilize? Will the embryos develop? And the worst wait is, after the embryo transfer, waiting for the pregnancy test. So the anxiety buildup is so high, and in various manners in which the patients express it. To add on, counseling is very, very limited because many of our patients have hesitation to go to a counselor. Somehow there is this mental block that they don't feel to go to a counselor and have a talk, although now this is changing. So, and possibly they don't want society to know. A large proportion of patients, especially in smaller towns, etc., don't want society to know that they're undergoing treatment. So this is where we feel that a subject like yoga, which deals with the body, the mind, and the emotions, and which is practiced by one and all, from a 6-year-old child to a 90-100-year-old. So therefore, if they start into this practice of yoga, it would help them. Now, whatever I'm going to talk about yoga, I would first like to express my gratitude to my guru, Yogacharya B.K. Iyengar, who in the 1940s and 50s, when yoga was an unknown subject in the world, brought it, revived it, and took it across the world. And what he also did it was made it accessible to the common man by using different kinds of supports, which I will demonstrate today. Now, the first expression of an emotional state of a person is expressed in the breath. So if one is anxious for any reason, leave alone the treatment of infertility or the cause of infertility, there's general anxiety for any reason. We say a person has butterflies in the stomach. The breath becomes short, the breath becomes shallow, and that builds up. Finally, when the anxiety attack becomes very high, there is literally a panic syndrome. So this is the first connection between emotions and the breath. Add on, if you see something very ghastly, if you see a horrible sight, one unknowingly holds one breath. Say you see an accident, that is the reaction. Spontaneously one holds the breath. So there is a very strong connection between the emotion and the breath. Now, as much as we would like to modify our emotions, we know it is out of control. Even for any individual, if I'm sad, I don't want to be sad, but something from inside is making me sad. How do I change that? And my breath. So now this whole subject of yoga, which has many dimensions, which includes the molding of the body into what we call as asanas or postures. The beauty is that the asanas, the postures, modify the breath, and along with the breath, the mind and the emotions. So in this case, what happens is that even if I'm very anxious for whatever reason, if I go and position myself in a particular posture, then my emotions, my breath changes, and along with the breath, the emotions changes. And this is how, when you practice regularly, it becomes very easy and natural to do it. So as Dr. Surveen said, it needs to be a part of everyday life. It is not just during treatment or during a disease condition, but part of it. But at least this is a start. So how do we modify the breath? How do we get to calm the mind if I'm very anxious? Now, the first and foremost signs of somebody who is very anxious, if one is observant, is that one sits like this, big tension. So this is where, the chest starts sinking, shoulders droop, neck shortens. Now, how do I change this condition? You will say move, but there's so much of tension that the body becomes hard and doesn't move. So I'm now going to demonstrate a couple of asanas, which are modified with the use of supports and props, which will help one to cope with this condition. So when there is too much anxiety, the head is overloaded, the capacity to think gets numb. So the first thing we would teach is to do asanas, what we call as Uttanasana. Now, in this particular case, you can use a chair. Any chair, every house would have a chair, and you would extend the feet. Now, you can see if I'm stressed, this is my condition. So I extend my trunk, elongate my neck, rest the hands on the seat of the chair, rest my forehead, and let my chest descend. So as I just said a few moments ago, a person who is anxious, it's like this, shallow breathing. A person who is depressed also has a sunken chest, drooping shoulders. How do I change that? If I tell that person, they are not able to change. So I will say, okay, spread the feet. If you are stiffer, spread more. Allow the chest to descend and rest the head. Now somebody will say, I'm very stiff, I cannot bend. So the solution is simple. Turn it around, or you have a table at home, rest the forearms, Again, see how my chest descends. Now, in this case, I can even rest my head and I stay. Now, when this happens, there are two things that happen. The chest, the emotional center opens out. But it is important of not what is done, it is how it is done. Yoga is a subjective science. So one cannot give a prescription and say do Uttanasana, because if a prescription is given and the person who is doing it is not trained, or the person who is making that person do is not adequately trained, they may even do Uttanasana like this. Now, this is not going to help because the chest is sunken. But if the extension of the trunk is done, elongation of the neck, then you can see the change. So it is also not just what, but how it is done. Then another asana, which is found to be very helpful in these cases of anxiety, is Adho Mukha Shwanasana. Adho is downward looking, Mukha is a face, and Shwana is a dog. Now in Adho Mukha Shwanasana, one spreads the palms wide and spreads the feet wide. Now, normally when a beginner or a person who is very, very stressed will be closing the armpits. So what we teach them is press the palms down, raise the shoulders up. Now you can see how the trunk descends and the chest descends, because my purpose is to open the chest and not sink the chest. So as we would have seen a dog, early morning, and then extend the neck. So we train the people to extend the neck and they can stay. Now a person is still. They say, I can't go down. So what should I do? Should I take my head down while just bending my knees and doing it? No, that will not be effective. The primary region is the emotional center should be open. So we use supports. So every house would have pillows and bolsters. So you can press and rest the head. Now with the head rested, chest open, sternum lifted, one can stay in the pose. So this becomes Adho Mukha Shwanasana. It's important that the legs are strong. If the legs are weak, you can observe how this area narrows. This is the area in yogic terminology wherein anxiety is reflected. It is the samanic and apanic region in our terminology. It is the abdominal area which is. Now, interestingly, while we are doing this, it is also that there is some kind of the reproductive region. Then now after doing that, as the head goes below the heart, the brain stops thinking. The brain gets into a situation where it is no longer dictated by those negative thoughts or this chain of cyclic thoughts. Then we move into what is called as Purvottanasana. Purva is the east. So we adjust. So this can be done on a bed. Now, just for demonstration's sake, I'm presuming that this is a bed and or a sofa, or you can take two chairs, and I put my pillow like this. Now, as I've already said, the objective is to get some opening in the chest area. So one sits. So because this is a chair, I'm going like this. Otherwise, one can sit on the edge of the bed, adjust the bolster, then curve back, now and rest. And if you're on a bed, your hands can be to the side. Now you can see what I refer to as the emotional center has opened out, and the anxiety zone of the abdomen is opened out. Add on, the pelvic area extends. So although you can see that for women as well as men, the reproductive zones, possibly there may be improved circulation. However, in the absence of evidence or any studies, I cannot talk objectively wearing my scientist hat. But however, as a yoga teacher, I can say that it does help in these kind of conditions. Again, here, legs need to be strong. And because of the support, a person can stay in this condition for 5, 6, 7, 10 minutes. Now, basically, the emotions, the negative emotions start settling down, and then the positive emotions start surfacing. Then from this, so what we started was head down, now chest opening. Then we go further into getting the head lower than the heart. to get your emotional center lifted. Whatever we talked about till now is that the emotional center is affected. So in this case, what we do is we add on further and we go into what is called Viparita Dandasana. So one sits in the chair, again lifts the chest up. The chest can never be allowed to sink. Remember, if I'm sitting and my chest sinks, even the abdominal area narrows down. If my chest is lifted, diaphragm is spread out, chest is lifted, abdominal area also extends. So the moment I go in, I raise the chest up, and then one lies down. Now you can see the sternum lift, the emotional center, how much more it opens out as compared to earlier. Furthermore, I can extend the legs and one can stay there. One can stay from anywhere 2 to 3 minutes to 10 minutes. So the timing builds up over time. Now, in case somebody has a back issue, we will say, raise the legs up onto a support. So you raise the high up, there is no load on the back. So obviously, as much irrespective, it's a comfortable position, I would like to stay, but in the interest of time, I will not. Then there is another pose wherein, as I said, the posture modifies the breath. Now, when one is tense, one needs to exhale more. Exhalation is letting go, leaving behind all those thoughts. Now, whenever people think of exhalation, if it's forceful, now what should be the quality of a breath? So sometimes exhalations, if somebody exhales like this, it's short. Short breaths are not required. Short breaths are anyway happening during anxiety. So the exhalations should be very, very soft. The inhalations need to be very soft. Sometimes when people take a deep breath, you can see it's hard. This breath is not seeping in. The breath is the one which is energizing us. If this breath decides to go, we will not exist. So if this breath is taken in, it should be absorbed by the cells of the body. So the ideal quality of the breath, as Guruji B.K. Sanger would often tell us, is like you're inhaling the fragrance of a flower. Now, if I inhale the fragrance of a flower, you can see how soft the breath is. But if I'm being examined and I take a deep breath, there is no seepage, so there's no energizing. So there is one pose which we call as Supta Baddha Konasana, which is absolutely totally relaxing the pelvic and the abdominal area, wherein you sit and then you just lie down. So when you lie down, this becomes the asana itself becomes predominantly exhalative. So the moment you lie down, your exhalations become longer and longer and longer. And with it, the mind becomes calmer and calmer and calmer. Incidentally, this pose plays a big role for people who have menstrual cramps and menstrual pain, as you can see of the widening in the pelvic area. Even people with endometriosis pain who have come to us to the yoga classes have been relieved of endometriosis pain. Whether changes have happened to the endometriotic condition, I do not know, but the pain surely has released. And I will add one more asana, which is Setubandha Sarvangasana. Now in this condition, this kind of pillows can be taken. One sits on the edge of the pillow. Again, the idea is, remember, there is a general thumb rule, there's a general mannerism in which we work, is the head lower than the chest. Emotional center has to be lifted up. Emotions are down. This is the emotion zone. So we can't just lift it up. So one goes and one slides down, shoulders rested and stays. And you can stay. It can be done for any amount of time. Of course, some people may feel that will any person who is stiff, old, maybe with all their physical limitations, can they do it? The fact is, anybody can do it. People in their age of 80s also do it. So why not these young couples? However, although I have shown this, there are fine adjustments. So initially, it is always advisable to do it in the presence of a teacher or a guide who can actually correct you. Small adjustments, because each human body is different. The behavior of the human body is different. How the body reacts to tension is different. So we take this into consideration. So what I have done is just shown a few asanas which can be practiced by any infertile couple. So at least their emotions are taken care of. At least it provides them symptomatic relief. So when they start treatment, they are in a neutral or at least a positive state of mind. Otherwise, you are already in a negative state because of the infertility, because of the stressors of infertility. Add on the stress of treatment, as Dr. Poonam said, 3.5% had emotional issues before the start, but as infertility progressed, it went into a very high number. Why should these people who are already having a problem get an emotional problem add on? It's clearly showing that infertility is an emotional problem and it is aggravated to such an extent. So I feel as a fraternity, all of us who are working in this field of infertility, we need to strive to give some kind of an emotional relief to the patients while we teach, go and treat the root cause of the problem, infertility, maybe ovulatory disorders, varicose fields, or unexplained infertility, or by bypassing the infertile condition by doing an IVF, ICSI, etc. So I think it's very, very important that we have this subject, which is Indian, which is available to us, all of us, which should be utilized, wherein you don't need anybody. You can do it yourself. You don't need to go to anybody. Nobody needs to know what you're doing because anybody would be practicing this. So a healthy person, a college student, all would be practicing it. So anybody can practice it. So there is no mental inhibition or apprehension. What will the world say? So I would like to end with my Guruji's quote: yoga cures what need not be endured and endure what cannot be cured. So as all of us working in this field of IVF, we definitely do know that we cannot get 100% success. Even if we talk of cumulative pregnancy rates, we do know that not all the patients who come for treatment are going to go back with a healthy child. So with that limitation, at least if we cannot if we cannot improve the quality of life, at least let's not spoil the quality of life of these patients. Because I always believe that for an infertile couple, which are in the most productive phase of their life, they are giving up everything for an unknown, uncertain future. So sometimes financially, they just give away everything. Emotionally, relationships, everything is lost for a future which is uncertain. So at least they can go through this entire situation by using these various tools for coping with these problems. And that is why I would like to say, on this Infertility Awareness Week, that we need to get people sensitized. Leave alone what the world does. At least the patients can start taking this up. And I'm very happy that IFS is giving so much of importance to our two SIGs. Dr. Poonam heads the SIG on counseling, and I'm on holistic health. And we hope to work in future for improving the quality of life of patients, while our other fraternities and colleagues are working on improving treatment modalities. So thank you very much. And we are open to any questions, any kind of suggestions from anybody. Yeah.
Thank you, ma'am. Thank you so much, ma'am. We have lots of questions now, so I'll start one by one. So the first question is from our one of the attendees. So she's asking, does the IVF treatment has the long-term side effects?
No. Having in the field, there is no side effect known as far as things are concerned. So if a couple has undergone an IVF cycle, there is an apprehension whether the stimulation, I don't know if there are couples who undergo 10, 12 cycles of stimulation, but in general, there are no side effects with IVF treatment. So nothing to worry about as far as the patient is concerned.
So ma'am, the second question is, I think, for Dr. Poonam, that how can we engage a woman in drawing metaphor who has not much knowledge on education, as she's having some blockage initially to start the treatment?
In fact, this is the method for people who are less educated and who are not very familiar with the language. It was developed for those women only. And we give a lead question like, first there is a discussion on how do you see infertility? How do you feel about it? Everybody gives an answer. And then we ask them to draw. Once they do the drawing, we ask them to explain more about it. So it becomes a discussion point. And in fact, like any projective technique, they reveal a lot of deep inner psychological dimensions through these techniques, and which even they are not aware of to start with. So it is the easiest method. In fact, it's used a lot in clinical psychology. It's used with children who are very non-verbal. So it is in fact a lot easier to use than and much richer information than giving psychometric tests, which give a very cross-sectional view of the patient. Whereas here, immediately one gets a insight into their total experience through the drawing.
Okay, ma'am. So, ma'am, the next question is when the couple should seek infertility specialist help if they fail to conceive?
See, the failing to conceive actually would be by definition is 1 year of, according to the WHO, unprotected intercourse. However, there are various factors. So in case, a couple is in the older age group and one is concerned, one need not wait. At least one can undergo a preliminary assessment. Especially today, male infertility is really on the rise. 50%, cases we see are male infertility. So therefore, it would be advisable to at least get a basic semen analysis done. Today also there are many kinds of medications that people take, lifestyle disorders as they say, smoking, etc. Very well known to enhance oxidative stress and therefore bring the sperm counts down and sperm motility down. So all those factors may contribute further to increase male infertility for that matter. So even the use of pesticides, which is of course not in our hands. So considering all these factors, if one can get some basic assessment done. So it's not that one needs to go in for treatment or consider IVF or anything as extreme as that, but at least some basic assessments can be done so one knows what one's status is. Yeah.
Okay, so ma'am, next question is again from a embryology point of view. Should a couple preserve their eggs or sperms if they need to delay the pregnancy? Delay the treatment?
See, that is absolutely a personal choice, I would say, whether one wants to preserve, because if one is delaying, yes, especially in cases of females, the quality of eggs would go down, the risks of abnormalities would be high. So therefore, yes, it is better to preserve the eggs. However, I must say it is easier said than done. Today, we have vitrification techniques, which gives us a very good recovery rate, survival rate of the oocytes. But however, one should be very sure of what one is heading for. It is not like you're putting the eggs in the refrigerator or in a freezer and going to get them back exactly in the same state, because the fertility status of the woman has not been proven. One does not know whether the woman is fertile. So if you have cryopreserved your eggs and you get them back, you are not sure that all of them would lead to embryos and pregnancies. So therefore, one should be fully prepared. And I think a lot of counseling needs to be done before one takes this decision. Dr. Poonam, you would like to add something on delaying pregnancy and cryopreservation?
I think it is, depending on the life circumstances of the couple. Nowadays, there is a trend for late marriage. There is people are getting married at the age of 40. So they realize, and if it can improve their chances of, if it gives them, a window for their reproductive success later, why not? But this cannot be a decision of the patient. It has to be checked by the doctor, and all the parameters of the body have to be aligned before this process can be done. So it's not just the patient decides and that's it. It's the physiology of the system has to be very much calibrated and checked, and then the eggs are retrieved and frozen, even in IVF. It's not just like that.
So, ma'am, next question is for Dr. Poonam. Should a couple consult a psychological counselor while going for infertility treatment?
The option is always open. Every center is supposed to have a counselor, and that option is offered to each and every patient. And definitely, if they get assessed, it helps, because there may be certain stresses, maybe anxiety, maybe avoidance coping, maybe social avoidance, or other things which can be seen very clearly once they are assessed by the counselor. And that would help us to take preemptive action and find out their coping mechanisms so that they are definitely much better prepared for the journey ahead. That is actually, ideally, I think every couple should get some interaction from the counselor, some basic evaluation, and that is actually being done through very quick, simple tools. So in about 10 minutes, one gets a profile of the patient on infertility specific stress, and if it is above cutoff, then definitely they have to be tracked. They have to be kept under scanner, even if they don't want. It's a voluntary thing, You cannot force somebody for counseling. And like Dr. Rajvi said, counseling has got its connotation. They have a lot of things. Am I mentally ill? Or what is, we don't want to talk about all these things. So there is generally a negative perception. But if we take on something like yoga and present it as a mind-body balancer, because that is what I tell the patients, the entire medical team is working to stabilize your biological system so that the implantation can take place. But if you are carrying a mental stress through your mind, then you are continuously destabilizing all the system all over again. The stress hormones are getting released. So whatever knowledge we have about mind-body connection on the immune system, I share with them so that they realize that it is not just the doctor's job. They also equally have to participate in the process of staying relaxed, staying stress-free. And I have shared my numbers with everybody. They are free to connect with me if they can't come on video call or whatever. So they know that at least somebody should be available for them in case they want to. And even if they don't want to, and if we see that their stress level is crossing the cutoff points, then we have to counsel them. We have to tell them, you are risking, you are spending money, you are, the doctors is putting in the best technology for you. Why are you not using your natural resource, your own emotions, your thoughts, and your body to enhance the process? And fortunately, we have data also from the research project which was done in Ellen Hospital 3 years with Dr. Sudha Prasad. And yeah, we did find very good outcome. We worked with 250 cases. It was a randomized control trial. So I can say with a lot of confidence that it would help them.
Okay, so ma'am, we have a live question. I am allowing the candidate participant to talk. So Miss Anjali Baba, you can ask your question. You can unmute yourself. You can ask your question.
Thank you very much. Can you hear me? Is that okay?
Yes, it's perfectly fine.
Okay, thank you very much for both the talks. Fantastic talks. And I think counseling and yoga are both very powerful tools together for achieving or for facing such a challenging journey that you are describing. It seems almost you need superhuman qualities to be able to go through the possibility of so many failures and yet keep going. I think as Poonam was saying, counseling, yes, probably comes as something people think is, I must be sick that I need counseling or what's wrong with me. But yoga is definitely considered as a self-empowering tool where people get the self-confidence to be able to control their own body, breath, mind. So I'm a yoga teacher myself, and I really enjoyed looking at the supported postures that Dr. Rajvi was showing. They look extremely comfortable, very caring, and someone who's needing protection and love, using those cushions and, opening the chest and the heart center. Now, I find in my classes, I do a lot of shoulder opening, chest openers, it's a general class, Satyanand yoga class. So it includes a lot of general body parts. But one thing I have seen with my students is that when we linger for a certain amount of time on a posture to stay steady and hold the posture, the mind starts to wander. So, for example, like what Dr. Rajvi showed, that you lie down on the chair, head back. Now the mind, the body feels wonderful. You're automatically breathing better, feeling relaxed, supported. But the mind, after certain sessions, maybe it would start to wander towards, the future, what's going to happen in this cycle. Is it going to work? So I'm thinking maybe you already include some visualizations during the exercise, if those could be helpful. On the other hand, making very positive visualizations could backfire if the child is visualizing a healthy baby while doing these exercises and then it fails, then it's like starting from a step behind. But anyway, my question is just general use of visualizations during yoga, breathing and postures, if that's got any role in your...
Okay, I can answer your first question. The fact that you believe that when one stays or holds the pose, then the mind wanders. The fact is, in the practice of yoga, we are not supposed to hold the pose. The point is that when one does it as a posture, the mind can wander. But when it converts from a posture to a yoga asana, the mind gets absorbed. So that is why in the practice of yoga, we have various stages of consciousness where it can be a wandering mind, what we call the Shipta, Vikshipta mind, to a seventh state of consciousness where it's a totally absorbed state. So therefore, the training is given in such a manner, and that's why I said that it is all, actually I said it also that we would like to do it teach the student rather than, give it as a prescription. So while that is being done, the individual's mind gets so much absorbed. So it is not about staying for 2 minutes or 10 minutes. It's as long as the mind is absorbed, then it becomes an asana. In that case, one doesn't need any external tools, but obviously it takes time. So if a new person comes in on day one, they may not even be there for 10 seconds, but over a period of time, and that's where the skill comes in. And that's how one builds up the practitioner. However, visualization tools are used. We use visualization tools not even to understand. Like supposing if you took the example of on the chair where it goes ups and down. And if I visualize that from the collarbone to my leg, I'm actually into a bow and the bow is tense, how it remains, then my body position will change. So if I'm sitting, for example, I will just show if I want to visualize. So if I'm sitting and I visualize like this, and I visualize there is a cross, that it's a cross. Now, if that cross has to extend, my body position changes. So we can use these kinds of tools. We use these kinds of tools and analogies to help one. But I would not like to lose visualization for something outside. I would like to use visualization wherein the posture changes, and along with the posture, the breath and the mind get involved. So rather than distracting the mind to something else. So this is how we utilize it in our tradition.
Oh, thank you. Yeah, that's very enlightening. So you're saying that the posture you hold as long as your mind is engaged with that posture, yes. And then it's up to you how long you hold it. But often the limitation becomes muscular as well as joint.
Then it's not yoga, then it's exercise, then it's a posture. That's why we call it yoga asana.
Actually, if I may add, the Iyengar yoga is somehow so designed that the mind just cannot wander. I don't know, because I have some experience with it, not such a beautiful postures like you did, Dr. Rajvi, but yes, I do some, I know how even a subtle change in the foot angle, how it can change the entire alignment of the spine. So it has to be, they are very precise, and I think I really wonder if they need a lot of supervision to be done correctly. They can't be done like that.
So, so you're talking more about then using yoga as a more a body tool with mind concentrating on what you're doing. You're here and now. You're not wandering. You so it's also, it has a relaxing effect at the same time, depending on the posture. But if it's something like the down dog, that's fairly challenging for some people's spines. So there, it is becoming more like a strength exercise as well.
I think from my experience of teaching for over 30 years, one has to adapt. So that's why I started saying it's a subjective science, where it is within the framework of what we would call a Lakshman Rekha or a framework, but there is still individualization, which is there in medical treatment. You have a prescription, but still there is dosage adjustment. Lot of things. So in the objectivity, there is subjectivity. So that is always being handled. And that's why I would say the skills of the teacher are very important. Like you want an experienced doctor to go to. Nobody wants to go to a fresh doctor who has graduated yesterday for anything. We want an experienced person. So here too, we make sure that a person who starts teaching in this tradition has at least 8 to 10 years of experience of personal practice. And only after that, they have the permission to teach. So there is a difference. So obviously, it's... so I can only talk about this tradition because I know with confidence that any part of the world one may go, you will get this. There may be variations from teacher to teacher, but you can go to any of the countries in the world. You will get this.
Yeah, fantastic. Yes, and I quite understand that. And the connection of breath, as you say, that you see person who's nervous, they're breathing shallow. So do you also, I suppose you must be doing some specific breathing, long inhale, exhale exercises too will be good for someone like that who's anxious. Is just learn how to breathe properly. In fact, there is a very recent...
so much to this science. I tried to give it in 15, 20 minutes, so I would have loved to, talk about this subject, which is very close to my heart, but, so there's so much.
I need to interrupt. So I'm really sorry to interrupt this interesting discussion because we are already above time. So I have a few more questions in the chat. I'm so sorry, Anjali. So I have to make it quick. So
no,
first of all, thank
sorry.
you for your insight.
It's very close to my heart as well. So I got carried away. Sorry.
No, it's really wonderful that you shared your thoughts and your questions, and you made the topic, made the discussion really interesting. Thank you so much for being on this program.
Yeah.
So we have one more person who's about to talk. So Kapil, you have any question? You can unmute yourself and you can ask the question. Okay, if not, then I'll take a question from the Q&A. So there's one more question related to the ma'am, you discussed about the cryopreservation of the gametes preserving.
Yeah.
So there's one question: can the embryos be refreezed after once thawed? If yes, does this affect their quality?
Yes, they can be cryopreserved again. It will not affect the quality. However, it depends on, again, I would like to say that although vitrification is a very good technique and the recovery rates are excellent, but it also depends on how it is done. So again, it is dependent on the skills of the embryologist. But otherwise, technically, it is there is no problem to the gametes, but it again depends on the skills of the embryologist who is doing it.
Okay, ma'am. Then one question: which postures can be advised to a patient after embryo transfer?
Oh, that's again a whole deep subject in itself, maybe some other time, because that's a very, very crucial phase, as you very well know. So one has to be very, very cautious. Yeah, so I'm sorry, I can't take this. Yeah, it will be another 1 hour and Vakil will ask me to stop.
Even when that would be more psychologically stressful phase when the embryo transfer happens, because I have seen when I was practicing post embryo transfer, patient is very much high in hope. Dr. Poonam, I would need your comment on this also. The post embryo transfer patient psychological levels are like.
This
Comment
is
from your side also.
identified as the most stressful time when they are waiting. And I've had patients, who are every minute looking at on some app, now the embryo is like this, now the embryo is like this. They are, so there's an obsessive rumination. So ideally, they should be prepared before they enter this phase. This kind of tendency should all be curtailed. But we have what is called coping cards. So again, these are self-management, self-educational, where they write 5, 6 positive affirmations. They make a small card, keep it in their pocket, look at it and read a few times a day, so that their mind gets out of that whirl of negative fear, anxiety and ruminations. This is the coping card is what is now being advised in Ashri, as because they cannot come to the office for relaxation or yoga nidra sessions. They cannot, if they are not already trained, ideal time is to catch them before all these processes happen, so that when they have the skill, they can continue on their own. The pre-treatment phase it is been proven that any intervention in the pre-treatment phase is very, very useful. But coping cards is probably the only thing they can do, if they accept it, if they can get used to it. The counseling is needed anyway for every patient, because some stress, some anxiety in our clinic, before every ET, we are giving a deep relaxation to every patient. And also, if possible, we try again during the treatment cycle, so that some preparation is there.
So, ma'am, we'll take the last question because it's open for all. So, the person is asking, so after how much time should we wait for the second cycle after the first successful IVF? It's more related to the clinical part, but I would request Dr. Rajvi and Dr. Poonam to answer. They have got success in the first cycle. Ma'am, you're on mute. So they have got success in the first cycle. Now they are planning, but I think the second cycle is also with IVF. So again, the journey is back to square one.
I guess this journey would not be so tough because you already have a success, and possibly you may have cryopreserved embryos. So already they are good. So I guess the normal pregnancy interval one would take it is at least 3 years or so before going in for the next cycle. So that's it. But that would be more of the clinician to take a call on that.
Yes.
I think there's one question. I think since it's an infertility awareness week, we'll just take that last thing which I noticed there. Yeah.
Yes, ma'am.
Yeah. What is that about?
So, ma'am, why the infertility is on the rise, and what are those things and the parameters affecting the fertility?
Okay, so Dr. Poonam already said late marriages, people start. Second thing is delaying parenthood itself. So if one realizes at the age of 20, 25, now it's 40, already the number of follicles, the number of oocytes is down. Also the environmental causes, stressors. Again, I don't really know how much stress is the, believe me, I always call it, it's not stress, but the perception of stress. It's not that this generation has stress. Our parents and grandparents and forefathers also had a different kind of stress, but we feel we are very special. We have a lot of stress, work stress and this stress and that stress. Possibly forefathers had less financial benefit thing, but possibly they were better handling stress. So maybe we perceive everything as stress. But apart from that, there is very well known that there are environmental factors, what we call as, there are substances in the environment which behave like estrogens and which are impacting male infertility in a big way. One of the biggest culprits is the pesticides. Unfortunately, we have limited access. We can't, at least I would say in cities, you can't grow your own fresh fruit and vegetables. Of course, that's the advantage of smaller areas, but then they're expensive. And in addition, also, remember, we also use a lot of pesticides in our homes. People believe that today everybody has a contract for pesticides. And if I paid up for the year, even if I have pests at home or not, I want to use them. So they contribute. So, if you're in a large housing colony, a contract is given for all those hundreds of apartments, and they come and they do it every 3 months. And with the poor ventilation that often exists or closed indoor ventilation, those things remain. So they do impact fertility. In addition, also plastics is found to be another major cause, especially in women. I remember a study being reported from Delhi, where there was a high incidence of polycystic ovaries and in young girls. And then they detected that the water tanks, which are all plastic, and today we consume water from plastic bottles. And mind you, PCO has been seen only after the mid-90s. It was there, but the number of cases that have been seen in the last 20 years was never seen before. So one of the things, and that's the time we moved to bottled water. So I think these are some of the factors, environmental and lifestyle, which could be the contributors. And Dr. Poonam, you may want to add some more. So these are something different. In addition, of course, infections, pelvic diseases, tuberculosis is one big cause in India. There's something.
Also, I think there's a paradigm shift also, that a lot of time is spent indoors, like, the connection with nature, with sunlight, with sky and greenery, that is lost. I'm sure that would also affect because in yoga, we absorb energy from these elements also, the basic elements, the sky. We do a Shambhavi Mudra for relaxation. Just look at the sky. Just try it. Look at the sky, open sky for a few minutes. Suddenly your whole body will feel so light. All the stress gone, all tiredness gone, So the whole concept of being in closed rooms, ventilated, all those things I'm sure are contributing.
So thank you so much, ma'am. So I think, ma'am, we are half an hour over than our given time, so I think we can close. So I would request Dr. Surveen, if she's on the call, to give the closing remarks. Dr. Surveen, if you are on the call, so I would request you to give the closing remarks.
No,
I think she's. So, ma'am, I would request Dr. Poonam and Dr. Raji, both of you, to give the closing remarks, because being senior, I cannot say anything. Please, ma'am. I would request you.
Yeah.
Well, I think there is such a deep connection between the thought, the emotion, and the body. And if all these three aspects are not integrated, I'm sure the outcome gets worse. I think that obsession with just technical biological factors and completely ignoring the subjective well-being, I think it's not a good story at all. Even if the person gets a treatment failure, but if their subjectivity, their strength of autonomy is strengthened through lifestyle change, through yoga, and through a wider perception of the situations, I think they don't go back hurt or mentally disturbed. They are okay. Even they are able to grapple with the alternate choices, like being child-free, devoting their life to other causes, or adopting a child, or they are very, very open to non-biological parenthood also. So I think I'm really looking forward to putting yoga into the whole system. I don't know how it will fit in, but that is my lifetime dream come true, actually.
Okay. Yeah. So I think it's time it's nice to see that we are now talking of emotions. There was a time when being emotional was, looked down. Oh, this person is emotional, irrespective of infertility. Today, then came a time when we're talking of emotional intelligence. Now is the time we take of emotional as a very important aspect of every human being, and respect people's emotions and work towards creating a healthy emotional state, irrespective of whatever it is. So I think in this field, especially in the field of infertility, we really need to work on this much more. We are technically extremely good, but I think we, in terms of IVF, possibly have the largest number of clinics in India, the largest number of embryologists in the world, but it's also that we also take a lead in this mind and emotional aspect. And I'm glad that, this has started with this. This is our first meeting of the new IFS term. So thank you, Vakil. Thank you, Vasudha. Thanks to Cooper for hosting it. And of course, a big thanks to IFS, Dr. KD there and Dr. Surveen. So that's it from me. Thank you so much, the attendees, and for your lively interactions. Thank you so much.
Thank you.
Thank you, Dr. Rajvi. Thank you, Dr. Poonam. From behalf of Cooper Surgical, we are really thankful for you to you that agree us to do this program with us, and we are really looking forward to more programs coming with the SIG Holistic Medicine. So Vasudha, do you have anything to say before we close the session?
No, I would just like to thank you. Clearly, it was highly engaging as we have obviously over time. So yes, it was a wonderful session. As Rajvi rightly put, it's very nice to see and that people have started talking about emotions and they are realizing that they are under stress. So that is very important for a holistic, livelihood, a happy life. So yes, it was highly relevant in these times. So yes, we look forward to have more such sessions and spreading more awareness on these lines. So thank you, Poonam ma'am, thank you, Rajvi ma'am, for such an enlightening session.
Thank you. Bye-bye.
Thank you, ma'am. Thank you. Have a
Bye.
good evening.
Bye.
Thank you. Bye-bye.
Good evening. Have a nice night. Bye.
Thank you.